looks absolutely fine. What was your concern?
Oozing out.
Oh, I see.
He's not even trying to walk on his own, and he won't do it for long. He'll drop.
I think it's time to give me a white tablet.
We're not allowed to give out those tablets anymore.
Just as bad.
I checked it when I was changing her, and it is slightly red.
Mummy, don't talk like that.
I'm sorry.
One of my best friends he committed suicide, and that's what's bringing me down.
She's having bad nights, doctor. She don't sleep at all.
Right, OK.
Primary surgery, how can I help?
Come in and take a seat. How can I help today?
What it is, I went on holiday to the south of France.
Okay.
And I got really badly burnt.
Like a sunburn or?
Yeah, really, my legs were blistered. Really, really painful. I was peeling really bad. I rang the doctors yesterday and they told me to get some stuff from the chemist.
Yes.
Which was this,
Yep.
antihistamine, and oh, not that. The nurse also.
Cetraban as well.
Yeah,
Okay.
but I put this on and it's burning. It's making me itch even more.
Right.
So I thought I better come just get it checked out because the girls at work are like, you never know, just be safe.
And is it stinging now when you apply
No,
it?
it's just really itchy.
And
but my feet
has
and
it
ankles
improved
swelled up,
since
so-
2 weeks ago, or has it got
Oh, the
worse?
itchiness has
or-
got a lot better, but it's mainly my tummy and here where the blisters were.
Right.
But I was vomiting as well on like the
Okay.
when obviously the first day
Were
I
you
got
using
burnt.
any sun protection at the time?
I didn't at the time, so that's probably why I got really
Shall we have a
burnt.
little look today?
Amelie. Hello. Oh, you got your princess crown on. It's not a princess one, is it not? Oh.
It's
It's
a
a what?
pink one.
It's a pink one. How can I help?
I think she might have a urine infection.
Okay, she had urine infections before?
No, but she's been potty trained for quite a long time and she's been wetting herself a lot the last week.
Okay.
And
She's not got sore down there because she's been wetting herself?
No, I checked it, obviously, like when I was changing her, and it is slightly red.
Mummy,
But,
don't talk like that.
oh, sorry. But yeah, she's got, I think.
Oh, dear me. Now, are you going to be able to do a little pee for me?
We did try at home.
Yeah? Do you think... Smile. Do you think you can do a little pee in a little pot if Mummy tries to catch it in the toilet for me? And then we can test it?
I don't need a pee yet.
Oh, OK. Well, we'll have a go in a minute then. Is your tummy sore anywhere? Is any soreness in your tummy?
This bit is sore.
Is it all the way up there? OK. Do you want to jump up on the couch?
My red boots are muddy.
I'm going to take those.
That's it. Oh,
That tickles.
have I got cold hands? OK, that feels all nice and soft. That's good.
Yeah.
All right, do you feel like you can do a pee now? Now I've pressed on your tummy?
No.
Just try and just catch a little
Yeah.
bit with
Oh,
that.
I need
Sure.
me.
Oh, she needs one. Good.
Come on then.
I'll be back in a minute.
All right. See you soon.
Up here, sweet.
What time was the appointment? Computers, they don't like Mondays, do they? No problems. Thank you for cancelling. Cheers. Bye-bye. Hello, sir.
So there's no further blisters, but
No,
it is a little
blisters,
bit red
blisters
still,
were
isn't
there,
it?
and just there.
Okay. Fine. Okay. I can't see any signs of infection, which is a good sign. It's not pussing, it's not wet and
Yeah.
weepy. Now, it will get better. It usually takes a couple of weeks.
It's just that I go on holiday again in just over 3 weeks, so that's why I was a bit panicky.
A sunny place or
Portugal.
Okay, you have to be really, really, really careful to avoid direct sunlight, particularly when it's the strongest, and lots and lots and lots of sun protection. Yeah. I would carry on with just the soothing, cooling after sun type of cream.
Okay.
Antihistamines are quite useful to reduce itching down, because what we don't want is to scratch and irritate the skin further. So the less touching, the better. Really, it's probably best to just keep them covered up to try and avoid that as much as possible.
Okay.
When you're showering, bathing, just keep to really lukewarm water, because hot water tends to make it more itchy, more irritated, and it sometimes burns a bit as well. But I don't think you need any antibiotics today. And obviously in future, lots and lots of sun protection, because I think you've got relatively fair skin, so you're quite vulnerable to sunburn. Okay.
Thank you.
It's all right.
So I'm going to use one of these, look. I'm going to use one of these.
Watch what the lady does.
And it's going to change colour. I'm going to pop it in here, like that. It's going to change colour, look. Right, so that looks okay. So we'll send off the urine to the lab, so that will check for any infection. Just in case she's getting obviously a bit of a rash, so just some Sudocrem just to help with that. All right, so we'll send that off. But if you feel she's getting worse over the next couple of days, then obviously bring her back.
Sure. Thank you very much.
Bye-bye.
Bye.
Hi there, come and have a seat. So, problems with the tummy, is that right?
Yes.
So tell me about it.
Well, I woke up and I vomited.
Okay.
And then for a few hours I didn't eat my food, my breakfast.
Yeah.
In the afternoon my tummy starts hurting.
Okay, where is it hurting? Can you point?
The lower stomach.
You going for a poo? Yeah? And you're passing urine, you're weeing okay? No problems like that? He's never had an appendix problem before or anything?
No.
No. Okay. And you said you're not eating and drinking something or nothing?
I keep on giving him water.
Okay. I just want to check your temperature first, okay? I'm going to put this here. Can I get you to stand up for me? And just open your mouth. Say ah. Okay, and then just lie down. One here. So if I push here, it's okay? Is this hurting here?
No.
So it only hurts if I push here?
Yeah.
So that you can feel?
Yeah.
Oh, yeah. Okay, fine. Let me get you to come sit back up. Okay. What we worry about is if you've got pain here and he's looking dehydrated, he's been vomiting, not eating as much, and he's a little bit tender where I'm pushing, you worry about an appendix. So I think I'm going to refer him to the surgeons.
Yes, hello, it's Dr. Ward here at Farnham Road.
It possibly could be, but it might not be.
It may be that we need to get a sample and send it off and look at it, OK?
What time is the appointment?
Have you looked at the back of your throat or not?
Take it easy, plenty of fluids, a little of the rice.
I can leave it in the pharmacy for you if you like. It's not a miracle worker. It will take a little bit of time.
That's fine. Concentrate on driving. I'll sort that out for you.
Take care. Bye.
Is that this one? That's a bit quiet, isn't it?
You worry about an appendix. You know what I mean by appendix? Like appendicitis, have you heard of this before?
I'm a theatre nurse.
Oh, you're a theatre nurse. OK, fine. So I'm worried about appendicitis, basically. On the one hand, I think it fits. Like you know, we've got the temperature symptoms. Actually, his throat is completely clear, and he's got tenderness where you'd expect it to be. But on the other hand, actually, I had to push quite deeply to elicit that tenderness, and he doesn't have any rebound or guarding. So I'm sort of 50-50, but he looks a little bit dry to me. He's still got a temperature now.
Because he's not drinking as much.
Exactly. And but also, is that because of the appendicitis directly? He's still got a bit of a temperature right now. He's 37.6. So I think I'm going to refer him to the surgeons. Okay, so let me just talk to them now, yeah? Are you okay to go to the hospital from here?
Yeah. What is good for him?
Well, hi there. My name's Mr. One of the GPs for Farnham Road Surgery. Can I refer a patient to you, please? So, 8-year-old boy who's had a 12-hour history of abdominal pain. He vomited once this morning. He's had a temperature on and off during the day. He's off his food. But I still think the appendix is more likely than anything else. Thank you. Cheers. Bye. So, we got there in the end.
Okay.
So he's expected by the surgeons, give them the letter, and then they will call the surgeons to come and have a look at him. Okay?
Thank you very much for your
No
help.
problem. Take care.
Thank you.
Thank you.
Bye-bye.
Bye.
See ya.
Mrs. Chiapetta? How are you?
I'm fine, thank you, Doctor. No, really bad.
Nice to see you.
Okay, nice
How are
to
you
see you,
doing?
Doctor.
How are we doing, Doctor?
Just take a seat.
Doctor, that's for you.
Oh, thank you very much.
Only little, Doctor.
That's very kind of you. Thank you very much. Thank you for thinking
Thank
of
you
me.
for yours well, Doctor.
How can I help?
Right, Doctor. I got real pain in my chest, tired.
Are you able to sleep?
That one, no,
No.
very.
Really?
Last night I never sleep, Doctor.
Because
told.
of the pain?
No, for the pain. I don't know why it was. I don't know.
She's having bad nights, Doctor. She don't sleep at all.
Right, okay.
She stays on her bed for hours and hours and she doesn't fall asleep until probably 5, 6 in the morning.
How long's that been going on for?
For a long
Must be going
time.
on for a while now.
Long time, Doctor.
Well, I want to give you an article about sleep. It's a set of natural techniques to change your brain biochemistry, to increasing the amount of sleep chemicals your brain produces.
Okay.
So it's by changing your environment, you change your brain and you make it more ready to sleep. And everybody will have to kind of take part in them.
Okay.
It'll probably send you all off to sleep after a week. It will improve your sleep, and it's the best article for patients that I've ever seen on lack of sleep or insomnia.
And it works?
Oh, it really works, yeah.
Okay, we'll try it.
Yeah.
We'll try it, definitely.
Yeah. It's just a natural way of tackling this. For a good night's sleep, I would recommend the following techniques. Avoiding alcohol, nicotine, and caffeine, because these are stimulants for the brain.
I'm feeling really tired, extremely tired. All I want to do really is sleep.
Increasing warmth, because that turns on your brain's sleep chemicals. So that would be a warm bath, a warm drink.
You're very tired, aren't you?
Your environment, reducing bright lighting, reducing very noisy music, no noisy TV, because they again stimulate the brain.
I do sleep very well.
Okay.
I usually fall asleep within the first 20 minutes.
Okay.
Then I wake up after 3 or 4 hours, and that's it.
Relaxation techniques, get yourself into a relaxed state, because that helps sleep.
I'm so tired.
How can you be tired when you're going away on Thursday?
Well, I think that's why I'm bloody tired.
Avoiding strenuous exercise or eating large meals in the 3 or 4 hours before bed.
I don't sleep well since we had children.
Is it that bad?
Sorry.
The commonest reason for insomnia, by far, is people's anxiety about their sleep. Most of us wake for 1 to 2 minutes every 2 to 3 hours. That's not unusual. Don't worry about it.
She's got really bad breath, really bad. Is there anything that she can do for it?
Yes, she needs to increase her intake of fluid to 2.5 litres.
Of water?
Water or anything. No.
All right, Lovely.
Nice to see you.
Thank you very much.
Yes, and I hope
I thank you to see me,
once you're very welcome. Once you understand this, I want you to be practicing it every night. Okay?
Yeah, we'll do, definitely.
Yeah. But of course, they might do it themselves, and you'll all be sleeping. Yeah.
Thank you so much.
Yeah. Bye.
Bye.
One moment. Women's health, that's to get the pill and stuff, isn't it? Okay.
But we don't have any clinics.
No.
Is it for the pill?
Yeah.
Find out when they run out.
They run out, yeah?
Yeah.
I'll do that.
God, it's so hard being a girl.
Can you imagine? I literally...
Taking a pill is horrible.
I can... Good afternoon.
So, my name's Dr. Siddiqui. Sorry for running slightly late.
No worries, boss.
How can I help?
I think I've got some carpal coming on in this hand.
Right, okay.
Because I had it in the left hand about 8 years ago.
Okay, fine.
And I think it's coming on this one because I'm getting pins and needles. Sometimes when I go to pick stuff up, it's like an electric shock.
Okay.
Runs up my hands.
Fine.
And, yeah. And they're sort of like, from time to time, they feel numb.
Okay, you've had it in that hand before?
Yeah, I had it in this one. And they've done the op.
Okay.
And at the same time, they did a steroid injection.
Into this hand?
Into this hand.
Okay, fine.
But, so the feeling, the sensation's back again.
Okay, how long's it been back for this time round?
About 3 weeks. Pins and needles from time to time, just, it's just aggravating, that's all it is.
Carpal tunnel syndrome is a condition caused by pressure on one of the nerves as it passes through the wrist. It can cause numbness and tingling. It can also cause pain, which feels like electric shock sensations in the fingers. And in extreme cases, it can cause wasting away of the muscles of the hand. Would you mind taking off your coat? We can have a quick look at the rest of your... Right. So, can you feel my finger? Here?
Yeah.
Here?
Yeah.
Yeah. Here? Yeah. And that all feels normal?
I mean, I could feel that, no problems.
Yeah.
It's slightly different, but not a lot different.
Okay, different to this
Yeah.
here. Okay,
Yeah.
fine. Now, I'm going to just tap on here. Does that bring on any sensation at all? Electric shock type sensation? Nothing like that?
No.
No, okay. Now, can you try and do this for me, where you put your hands together like this?
Right.
Yeah. And just bring them up so the arms are straight. Is that causing any of the same type of pain to come on at all?
I've now got pins and needles in that finger there.
Okay, fine. So, right, just a few movements quickly. Can you squeeze my fingers as tight as you can? Good, that's fine. Can you put your fingers together like this? So, thumb onto the little finger, and just don't let me open them. Good. And thumb onto this finger. Good, fantastic. That's all fine. So, the power is normal. I mean, I don't think it's that bad that it needs any steroids at the moment.
Right.
But certainly you could benefit from a splint to try and keep it steady and try and prevent the pain from getting worse. If that doesn't work, then you may need a steroid injection.
Right.
A steroid injection is given directly into the wrist, and it works to relieve swelling and reduce pressure on the nerve. It's a very good treatment option in the short term. Surgery is generally used as a last resort when the symptoms are persistent or when the other treatment options have failed. A ligament in the wrist is cut, which allows more space for the nerve and reduces the pressure, and thereby reduces the symptoms that the patient's experiencing. You can try ibuprofen as well to see if that helps, because it's an anti-inflammatory. It may help with the type of symptoms that you're getting.
Right.
Is that all right?
Yeah, that's fine.
If that is not controlling your symptoms, come back and see us.
Yeah.
Is that all right?
Yeah, that's fabulous, yeah.
Hopefully that helps with these symptoms.
Nice one,
All
Doc.
right?
Cheers, mate.
No worries.
Nice one.
Take care.
See you later.
Bye-bye.
All right, how can I help you today?
Went to see Dr. Taylor.
Yes.
Because I was getting lots of bruises on my leg, which I keep getting.
Okay.
And I don't bang myself.
Yeah, they just happen.
They just happen.
Yeah.
That's the sort of bruising that I get.
Have you got any at the moment?
Not at the moment. That one is starting to go down.
to
That was
fade.
sort of down there.
And how long have you noticed this happening for?
A couple of years or so.
So I wonder whether this is happening in the area that it's happening because of your veins. So it's something called venous insufficiency. In some people, as you get older, your veins aren't as good at getting the blood back up. So what normally happens is, if you've got the veins where it sends the blood back up, right?
Yeah.
This relies on the muscle action to act as a pump. So whenever you're walking and things, you'll pump the blood back up.
Yeah.
But the thing that stops it from just dropping back down due to the effect of gravity is you get these little valves.
Yeah.
And they're like one-way valves. So they'll let blood go through this way, but not come back the other way. So as you pump, it just goes up and up and up. And as you get older, these can get a bit incompetent. So as a result, you end up with a bit more backfill, which can cause skin changes. I don't know whether the bruising is linked to that, but it's the only thing that I can think of that would be a reason.
Yeah, because I do tend to get cramp in my calves as well.
When do you get that?
Night time.
Have you had restless leg syndrome?
I've heard of it.
Yeah, so that sounds...
I don't really suffer from it, though.
This sounds like it might be a version of that.
Yeah.
What I want you to do is try taking magnesium supplements. That can help with the calf symptoms. So that's one thing. But from the bruising, I think the only thing I can do is try and reassure you that I'm not worried there's something sinister going on.
Yeah.
If you start getting any swelling symptoms of the ankles, if that starts causing you problems, then come back to us, because there are other things like stocking.
So the stocking be sort of like you get for thrombosis, that sort of thing.
It's a similar sort of idea, but this time it's to try and stop the fluid effect of it. But you're nowhere near that at the moment.
Fingers crossed I don't get any of this.
Oh, you will be teased. Tell the grandsons that you're wearing stockings.
Oh, look, Grandad's wearing stockings.
So I'm not going to give him ammunition for that today. Take care, okay? Nice to see you. Take care then. Bye-bye. See you. Nice to meet you. Bye-bye. Bye-bye.
How many tattoos you got?
16.
Have ya?
Only little ones. Most.
She's had like a heart of forget-me-nots with Dad on it. I'm not going to have all that.
How much does it cost? Depends what you want.
I do it on the inside. Oh, look at me.
Do you know how much I charge for these?
I should have asked first before you did it, shouldn't I?
You're really clammy.
That's because I'm...
Hot stuff. That and that was 40 together. That was, I can't remember, I was really drunk.
Lawrence Perslow, please. Good afternoon. Have a seat. How are you?
Yeah, not too bad.
How can I help?
A bit of a problem. I've had it for nearly 2 to 3 weeks. I've got a cyst on the back of my ear. It's got really sore and it's really irritating my sleep.
Has anything come out of it?
Nothing.
No. OK. Is it possible if I just have a look?
Yeah, sure, I will.
There is a change on the skin here.
Yeah.
Is that hurting you?
Yeah, just a little bit, yeah.
Right. But it's also tender here?
Not really, no.
No? OK. So it's possibly when it rubs against the back there.
Yeah, that's it, yeah.
All right. Can I check the glands in your neck?
Yeah, sure.
Any other symptoms with this?
No, that's it.
I mean, looking at it, there does look like there's something that wants to come out a bit.
Yeah, it feels like it's like floating on top of the cartilage.
It looks like a bit like an acne spot. You know, if you squeeze them and you get yellow pus coming out. So very much like that. Now, if you've had it for almost 2 weeks and it's becoming bigger and bigger, because of where it is on your body, it can get more tense and painful because the skin is so thin in that area. So if you want, then I could give you an antibiotic.
I was just wondering if I can get cut out or something.
That might be more extreme in terms of management at this stage. But if you want help for pain relief, ibuprofen might help with the swelling a bit more. And then on top of that, I'll give you an antibiotic to help calm this down.
Yeah.
Yeah? Is that all right?
Yeah, that's fine.
Yeah? OK. Is everything else OK at the moment?
I ain't gonna lie, I've got some mental health issues as well.
Yeah.
I can help. Hello, my darling. Repeat prescriptions.
Come here for a very, very small purpose.
I'm trying to get a repeat prescription.
Isn't it so my prescription is ready?
I left my prescription medicines in one of my relatives' house in Northampton.
I lost my prescription. Am I able to get another one? Or have I got to see a doctor?
I need a list of my prescriptions for the hospital. I don't even know who my prescribing doctor is. I haven't got a clue.
Prescription full. Mr. Bonavisky.
Been asked to give you these, Jim.
See,
Don't shout at me.
when's the last time I shouted at you? Francesca Barnes, please.
According to that, you done there.
Oh, no, don't worry about that. They change me around all the time, so I'm never in one place twice.
Okay.
Take a seat.
I forgive you for that.
What can I do for you today?
I take tramadol 2-4 times a day. That is the hospital order. I got a phone call from Kay the chemist last night. Mrs. Barnes, I'm sorry, but you can't have any more of those tablets. The doctor stopped it.
Do you know they haven't stopped it because your prescription has been done
Yeah.
yesterday.
I
It
know.
wasn't. The problem is it can't be done electronically because it's what we call a controlled drug. So we can't send it electronically across there. Let me go and see if it's sitting outside for them to pick up.
Yeah, it should be there. But she told me no. All the others they got it, but not the tramadol.
But the pharmacy won't get it electronically. So all the rest goes zapping through the air, but the tramadol has to be printed out
So
because
it
it's
might
a...
be standing up on the tree somewhere.
Yours hopefully will be on a piece of paper, so I'll go and have a look. Can we look up wherever the scripts are now, Francesca Barnes, because she's only come in to get her tramadol script, which seems to have been done yesterday. Oh, thank you so much. There it is. It was sitting outside waiting for them to pick it up.
I'm going to have a go at them because I didn't sleep.
They must know that we cannot send this electronically.
Well, they've done it all the time.
I know. I don't understand. But it was done, and it was done yesterday with all of your other tablets.
Don't worry about it, but must have tramadol because last night I didn't take it.
Oh, dear.
And I could have cried.
No.
I think it's time to give me a white tablet.
But the one to... We're not allowed to give out those tablets anymore.
Just as well. Because...
We have to refer you to the vets.
Now you're fed up with me, so I better go. Well, you've got
fantastic.
a lot of work.
There's a lot of work today,
And
you're
if
right.
somebody listens when we get told, we talk.
That's for you. And look, I've dropped this one.
Okay, I'm sorry.
Oh, and only treading on it as well.
Oh, well, never mind.
There we go.
Thank you.
Nice to see you.
Thank you very much.
You take care. Bye-bye.
Bye.
I ain't gonna lie, I've got some mental health issues as well.
Yeah.
Because I've got a doctor's note to say I can't work with my anxiety and that, with my depression. I've got this, I've got ADHD
Yeah.
and dyslexic, and I've been diagnosed with dyspraxia as well.
You were on tablets before to help with your symptoms, is that right?
No.
No?
They did ask me if I want to go on them, but I refused.
Okay.
Because I had one of my best friends there over 10 years ago.
Mm.
He committed suicide. And that's what's part of it was bringing me down. Because with my nan and granddad dying and that a few years ago,
Yeah.
I've got a lot of anger and that inside me. At all the funerals I've been to, I've never cried once.
So your friend passing away was a bigger moment in your life?
Yeah, and my nan and granddad.
And your band, okay. How old was your friend?
He was about 26 when he passed.
And was he on treatment? Is that?
Yeah, he was on medication. That's what made him a bit worse.
Right. Obviously, there might be more to it, but this is exactly what we need to talk about in more detail to explore why, or how that might be affecting you. But obviously, you've got your own individual things that you need to talk about and deal with, perhaps. So definitely come back, even if you feel you need a double appointment. At least we can go into that in more depth. Yeah.
Yeah, definitely.
This is for your ear for the time being.
Okay.
It's fairly simple antibiotic, but if it does get bigger and starts to spread to the rest of the ear, come back. And then for pain, shall I write it down for you? Do you have ibuprofen at home?
I have no paracetamol or nothing.
No? Is it something you can buy?
To be honest, I'm not the richest person. I am broke.
Okay. Last time the doctor went quite a lot in detail about how your thoughts about harming yourself and things like that. Has that ever crossed your mind since you last saw the doctor?
I have, yeah.
Okay.
Because I've got some family problems. I've got my own problems, and that's just bringing me down. I'm just getting really depressed and that.
Right.
I don't think I'm going to harm myself, but I do want to hurt myself.
Right, okay. Can you go to week's drive surgery?
Yeah, I could do that.
So I think it's important we do look at this. Okay, so that's a Wednesday. All right?
Okay.
So that will help hopefully solve your ear problem for now. All right?
Okay, then.
Is that okay?
Yeah, that's fine. Thank you very much.
All right, take care.
Cheers.
Bye-bye.
My knee felt really dodgy. I was playing football.
Yeah.
I think I'd bent it one way. It was fine, but then the next morning I couldn't walk on it at all.
Okay, yeah.
It's been, well, God knows how long now, and it's still, killing. I can't run on it or anything.
Okay, so not playing sports on it at all?
No, can't do anything on it. And I'm a PE teacher, so it's quite hard at the minute to not do anything.
Yeah.
I can do all this stuff, but it hurts when I get to there. I can't balance on it or bend down on it.
And what happened? What, was it a specific thing or just after playing football you noticed?
It was basically someone had come in and barged me, and I think I put weight on it and tweaked it a little bit.
Yeah, okay.
And then I managed to play on, but it was hurting like mad. But the next morning, like, couldn't walk on it at all.
And in the meantime, has it been sort of swelling and going down or anything like that?
I haven't noticed any swelling, but it just hurts.
Okay, fine. So let's have a look at your knee first.
Yeah.
How should we do this? Because with the jeans, will they come up?
No.
I'll tell you what we'll do. Can I get you... If you just take your jeans off for me and then come around there and then just have a seat up on there and then I'll have a look at it that way. Just give me a shout when you're ready,
Yeah.
Your left knee, wasn't it?
Yes, yeah.
Good to go?
Yeah.
All right, so let's have a look at the two together. Just bring that up.
Yeah, that's where the pain is inside there.
The joint itself is pretty stable, actually.
Right.
It doesn't look particularly inflamed either.
Mm.
All right, let you get changed and we'll talk through it.
Cool.
Okay, so basically, on the one hand, it's 2 months worth of pain that isn't really settling, and that's with you not really doing any sports on it. So that, on the one hand, that's a little bit worrying that there might be something more significant going on from that injury.
Yeah.
But on the other hand, when I examine your knee, it's really stable, you know?
Right.
So testing the ligaments, it feels pretty stable and feels kind of normal.
Okay.
So the issue here is there something that would need surgery? That's when you start to get to this time frame, 6 weeks and above, you start thinking, well, is there something that's going to need surgery? And the thing that goes against that is how reassuring the examination is. I think at the moment what I'm saying is what I want to do is give you some anti-inflammatories if I can, or something to help with the pain to try and normalise what's going on in terms of the function, right?
Okay.
The second thing is whether we do physiotherapy.
Mm-hmm.
So I think if it's been this far down the line, physiotherapy would be useful.
Yeah.
I think if all of that doesn't work, then the next step is going to be referring you on to a knee surgeon for them to consider imaging, basically, to see if there's anything that needs to be doing.
Okay.
Fantastic.
Thank you
All
very
right.
much.
I hope it gets better.
Yes.
Take care, okay? See you then. Bye.
Ryan was the only one that noticed my hair.
What have you done to that?
I had it coloured.
What with the greys, ready for Christmas?
Yeah. I did them with blonde, so they still look grey.
Come and take a seat on Mum's lap, hey? That might be better. What's the problem?
I had a chicken pox.
Yep.
Probably infected her.
Yep.
So I found some spots.
Let's have a look, shall we?
Lovely one.
When did you have it? That's terrible having it as an adult.
Oh,
How were you?
yeah, tell me. I'm better,
Yeah.
but it's still, you know, it's drying out so slowly. And my ego, you know.
You didn't have it as a child?
No.
No?
No. I could avoid it for 40 years.
How is she in herself?
She's fine. She doesn't have a fever, and didn't have.
Yeah, it is. There's one there.
Yeah, and on the back.
There's one there. There's one there. That little blistery thing on the top there. Yeah, when do they start today? Or?
I found 2 spots yesterday.
Yeah. So yes, I think it's chickenpox. So the same thing that you probably heard about for yourself. Okay. So it's it's a virus in any case, so you can feel unwell with it. Adults normally more so than kids. And in fact, with adults you can get some really nasty sort of terrible headaches that come with it, and often a chest complaint as well. Whereas kids often don't have that, so they tend to have a milder form. Some of them will get a few spots and that's it. And others will be covered in spots.
Yes.
Okay. You can try whatever you want to stop the itch. It'll be itchy. They'll probably scratch them. Okay.
Yeah.
You can use a bit of calamine lotion or something just to dab on it. It's not a miracle. Okay. So it will still probably cause some problems. The times that we worry about it is if some of them become infected on top of it. Okay. So if you've got a scabby thing which becomes really pussy and really red and the red's spreading, then we would need to see her because that's probably another bug that's just got on top of that. Or if she starts developing on the edges of her eyelids, we will sometimes use an eye ointment just to protect the eyes from that, okay? But if she gets any temperatures and fevers, then just a bit of Calpol. Make sure she keeps up her fluids. See how you do.
I know. All right. Thank you very much.
Okay, good luck.
Yep. Fingers crossed. Thank you so much. Okay,
That's fine.
thank you.
Come in.
Are you able to change a quantity of patches for me?
I'm able to, but whether I will do it or not is another thing. Just take a seat. So what's your name?
Kearney.
Oh, you're Kennedy, are you? Yeah. Yes, it's a very unusual name.
No, I know.
Yeah. Sounds like a name that you'd come up with in Neighbours or something like that. You're not Australian, are you?
No.
Okay. So where'd you get the name?
My mum said it was from a man's surname.
Oh, right, okay.
McKinney.
Oh, right, imagine. Very good. So that's where it came from, yes.
Thank you.
There you go.
Come on.
Sorry.
Sorry to keep you waiting. It's been...
We've got 2 live wires at the moment.
Have you?
Yeah. Right, sit down then, please, baby. Oh.
Now, what can we do for Maliki?
He's almost 18 months now.
Yeah.
And he's still not walking.
Right.
And when he tries to walk, it seems to be this leg kind of goes in, his whole foot turns in.
Yeah.
So I don't know if that's stopping him or anything. But I had issues with my feet when I was a baby, and so did his dad.
Yeah. Can we just take these off and see what his
Yep,
feet
that's
are like?
absolutely fine.
And also let's see him standing. Generally speaking, children walk between 9 and 20 months. If a child's not walking by 18 months, it's advisable for parents to bring them to see us. Doesn't mean we'll refer them on, but at least we can have a look and see if there's a real problem that needs dealing with.
It's this foot that goes all funny. Come on in.
Keep him going, see if it comes.
But I mean, like, he's not even trying to walk on his own, and he won't do it for long, he'll drop.
Drop, yeah.
Things like this. Let's go. Good.
I've got this problem with my head.
I've slept funny with my knee.
I have a problem with my toe.
There's a big chunk of wax.
Sometimes I've got dizziness. Sometimes I've got, like, headlessness, whatever. I can't even put my neck out, it kills.
It just feels like I can't bend my leg.
This is blowing up.
I can actually see it through your jeans.
I've got bad toenails. Look up for me.
Oh, yes, indeed.
Say, overriding of the toes.
Keep your head still, look at my finger, and follow it with your eyes only, OK?
I fell out of bed. Don't laugh.
That hurts, doesn't it? Sorry.
Do you take confessions?
Yeah.
I did go off my tablets.
I don't drink, I don't smoke, so...
There's your problem.
Oh, I'm going to start all my GB says.
You're right. I mean, he's very flat-footed, so what I'm going to do is refer him to the podiatrist, but that will need some correction. But if he's not, you can't sort of correct it before he starts to walk because it's of no use.
Oh, I know that. I used to have boots when I was younger because I used to walk on the inside of my foot as well.
And he's doing the same. So I think he may need something like that. What I'm going to suggest is if you can keep encouraging him, because some children are slow to walk, and if there's a family history, it tends to run in family. I'm not terribly worried even at 18. Some children are up to 2. If it's after 2, then you sort of begin to think of other things. But I think because of the very strong family history, because he's got what we call a biomechanical problem, that's probably not helping him, OK? I mentioned that Maliki had a biomechanical problem, and in his case, it was his feet turning in. It may just need a simple type of boot to help correct the in-toeing. It may need some physiotherapy. If it was really bad, there are some cases that need surgery, but that's very rare. If you come back to see myself or Dr. Ward, because I have a special interest in musculoskeletal things. OK.
Thank you, my dear.
OK.
Can you open the door for me?
Can you get it?
Can you do
Pull
it?
hard. Now, this is a very heavy door. Yeah.
Pull! Yeah, he's got strong muscles.
He obviously has.
He's my superhero, that one.
Good, 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 good. Good. OK.
Thank you.
Take care.
Come this way, baby.
Romek, please. Hello.
Thank you.
Right, you have some stitches to come out.
No, they're out. I had the surgery about 4 weeks ago.
Oh, right, OK.
And the stitches out about a fortnight ago.
We'll have a little look. And what surgery did you have?
Neck of the femur
Oh, right.
broke and I snapped. And
Oh, gosh. How did you manage that,
I
then?
was on a mountain bike and I fell off. Crack.
Oh. All right, lovely. Oh, it looks absolutely fine. What was where was your concern?
Oozing out.
Oh, I see. There's no sign of infection. There's no redness, no inflammation or anything going on. So
together?
I can clean it and put a fresh one on for you at the moment. That's absolutely fine. But it looks okay. So I'll clean and redress that for you. Are you all right stood there?
Yeah, fine, thank you.
Okay. You must have come down with a heavy thud to have
I had a crack as well, you know.
fractured your neck of femur. Goodness me.
Thank you.
Right, lovely. That's absolutely fine. Yeah, perfect. Have you got any more dressings?
I have,
Yeah, okay. Right, that's it.
How are you?
Well, apart from falling over all over the place, I'm fine.
Well, really, are you? Yeah. How many different sites have you fallen over in?
Quite a few.
Really?
Yes, quite a few.
Did you injure yourself at all?
Yeah.
What's making you fall?
Yeah.
Really?
Yeah.
Dizziness, you mean? Or?
Well, no, I've had this, I had a really bad cold. I used to get infections every month when I was seeing Dr. Sharma. And in the end, she sent me to the hospital, they hoovered it out.
Yeah, yeah.
But what I'm bothered about is, I'm a bit unbalanced anyway with my fashionable statement here.
Yes, indeed. Yeah.
Socks and sandals don't go.
It's kind of you marking out your individuality.
Absolutely. So, but, you know, that's why I'm a bit wobbly anyway, even with my crutch, so...
Were you falling?
Yeah. Yeah, I mean, look, I've got a lovely... I've whacked my knee. Look at that.
I see that. I thought Linda had just landed one on you.
Well, probably. She did with a black eye, but
Oh,
look.
my, look at this, yeah.
So it's, that's autumn and falling.
So how often are you falling? A few times a week?
Yes. Especially if I get up to go for a wee.
Is this ear okay?
Yeah, it's starting to sort of... I think it's feeling sorry for itself.
And do they get itchy, these ears?
Yeah.
Do you use olive oil in them
I
as well?
have done, yeah. To start with, I'd used olive oil, but...
Yeah, I see what this is like. There's not enough to hoover out, you'll be glad to hear.
Oh, I'm so glad.
But you should certainly be using ear drops. Open wide. Yeah, you're rather dry. Do you drink lots of fluid or not?
Not as much as I ought to.
Yeah, that's right, yeah. Your throat's very dry. This is an external otitis, so the canal, you're probably, for some reason, prone to it. I prefer you to use ear drops, yeah, and you use 2 or 3 drops in the right ear twice a day.
Oh, the other thing, I saw you were taking more patients back on a list.
Yes, I am, yeah. Yes, you can just write, you have to write to...
I have to write, do I?
Yeah, you do, yeah. And I'm very happy to have you back, but the request needs to come from you. Yes, yeah, good.
Thank you.
You've got to get up, slowly and carefully.
Oh, right.
I was going to say gracefully, but...
Graceful? Oh, you think I can't be graceful?
You can. You can.
See, I dressed up for you today.
2,000... Yes, thank you very much. I do appreciate this. I'm getting better at recognising it than I was.
Yes, absolutely.
Yeah. It's very bad of me not to recognise that.
It is very bad.
I feel fit as a fiddle, Doctor. Good on you, mate. See you, Clive. Cheers.
It's a heavy door, isn't it?
Take care. Oh, she stopped crying now. All right then, bye.
Bye.
My dad had high blood pressure, he had a stroke, my mum had a stroke, my sister's diabetic, she has heart problems. So it's in the family.
It's in the family.
Yeah.
She has noticed a painful lump. I think she needs to be seen.
That is the most uncomfortablest thing I've probably ever had, but I don't care how. I
am so sorry.
Oh.
When you're younger, you hit yourself and you go, and of course, but I'm getting older, so I'm forgetting things, but I don't remember banging it.
The main artery was over 70% furred up. They said she was a major stroke waiting to happen.
I thought, oh, Christ, when you're bleeding from the ear, you know, you should think to yourself, you know.
The end is nigh,
Yeah.
Farnham Road Surgery, how can I help? 9:10 it was, she's missed it. We don't have 10:09 appointments, it was 9:10. So you need to phone back at 12:30 for an afternoon appointment. OK then, bye-bye.
Lauren Manning? Dr. Hyder, come through and have a seat. How can I help you today?
For about a year, it was not long after I had him, waking up in the morning and not being able to move my hands.
Oh, OK.
When he was really little, I'd wake up in the middle of the night and I couldn't even unscrew a bottle to make his milk. And then it's calmed down, and then I just found out that I'm pregnant again. And the first sort of 4 weeks, they were terrible, to the point where in the morning I couldn't even get them dressed.
Right.
I spoke to my mum about it, and she's had carpal tunnel. And she said to me, it sounds similar.
Do you feel tingling?
Yeah, you know, before you get pins and needles, you get that dead arm sensation. It's just like that. And I can't do anything
And it's
with
both
it.
hands?
Both hands.
Any visual problems?
Sometimes things go a bit blurry. I don't know if that's just from having kids and just not having enough sleep.
OK, so how often does that happen?
I don't know. I don't even take much notice. I'll just be driving and think, oh, God, my eye's gone a bit funny. Steady.
And is that one eye or both, do you think?
Probably my left, I would say.
OK, so is it all right if I examine you? I want to examine the nerves that supply your head and neck, and then your arms as well.
Yeah.
OK.
Can you not?
So I believe you've been referred to having your knee looked at by the orthopaedic people, and
I have, yes.
And have you seen them yet or not?
No, I've got an appointment at Heatherwood Hospital on the 28th.
OK, right, good. OK, so that's underway.
Yes.
And this is with a query as to whether they'll go ahead and replace the whole knee. OK.
Yeah.
So the question is, can I help you in the interim by injecting into the knee to see whether it calms it down a little bit for you? And the answer is yes, I can. Are you happy for me to go ahead?
Yes.
OK, mate, I'll get this injection ready. A couple of things about it. Firstly, it's a steroid. It may flare it up for a few days, OK, before it starts to work.
Well, I've had it before.
OK, so you know
So I know what happens, yeah.
OK.
So the last time I had it in the hospital, suddenly started to feel frightened to death because someone went in before me and there was a massive scream. And all of a sudden, there was doctors and nurses flying from everywhere.
No.
It stopped breathing.
No.
Yeah. And I thought, I've got to go and have that.
Well, I'm going to try and avoid that today. Come and have a lie up here for me.
OK.
If we can get you up here.
Yeah. I struggle sometimes to get into the bath.
There was a thing on the news a few weeks ago. There was that dear old lady. She took a bath and couldn't get out. She was in there for 4 days. And she survived. But the reason she survived is because on every Wednesday she used to go down to the same cafe. And when she didn't turn up, they got really worried about her. So they went round to a house and heard her calling and got the police and pulled the door down. It's a lovely story. But,
yeah, that could be me, you know.
What do you reckon? Make sure you start going to some place all the time with some nice stuff. I need you to try and relax that as much as you can so it's as floppy, really. You're doing well. Still with me?
Yes, I'm still with you.
Right, it may hurt for a few days.
Okay.
Hopefully after that it will just sort of ease off.
Yeah.
Nice to
You're
see
very
you.
lucky. Yeah, nice to see you. Thank you for
I hope
that.
the operation comes along as soon as possible.
Yes, so do I.
OK, mate.
Well, I'm looking forward to it, I'm afraid.
See you later. Bye-bye.
Thank you.
Follow my finger with your eyes. Are you getting any blurred or double vision?
Yeah, a little bit.
Where did you get it?
There.
OK. And can you feel me touching you?
Yeah.
Is it about the same on both sides?
Yeah.
Screw your eyes up tight and stop me from opening them. OK, that's fine. Do you wear glasses at all?
No. I had my eyes tested since I was about 14.
OK, well, it'd be worth doing that as well, wouldn't it? Yeah, with all of the symptoms going on.
When you've got kids, you just forget about yourself, don't you?
Yes, you do.
They're more important.
So if you can keep your head still and just focus up here.
Yeah.
Try not to look directly at the light. OK, that's fine. I'm wondering what's going on. And then if I can check your arms as well. So if you can just roll your sleeves all the way up for me. You're being very good.
Oh, that's my tag then.
So can you feel me touching you?
Yeah.
About the same on both sides? You squeeze my fingers? Yeah. Put your arms up like this and stop me from pushing them down. Put your arms in front, push me away. OK, spread your fingers apart like that, stop me from closing them in. OK, that's fine. So with carpal tunnel syndrome, it's very common
Yeah.
and it becomes worse in pregnancy.
Yeah.
So it could well be that. The thing that's a bit unusual though is, and you've also got some eye symptoms too.
Yeah.
So I think it's worth referring you to see the neurology doctor, so the specialist.
Yeah.
And the thing we want to make sure this isn't is something like MS, so multiple sclerosis. Have you heard of that?
Yeah, I work in care, so
Okay,
I look after
yeah.
people with all sorts of
Yeah.
random things.
And is there any family history yourself of MS?
No, nothing in my family, no.
MS is an autoimmune condition, which is when the body's immune system can attack its own cells. In the case of MS, the immune system starts to attack the nervous system, and in particular, the myelin sheaths, which is a fatty substance that protects nerves. Women are twice as likely to develop it than men. It is also more prevalent in people with a family history and people aged between 20 and 40 years. So that's a referral to make sure it isn't something like that.
Yeah.
And if they think it isn't, then we can look more at the treatment for carpal tunnel syndrome.
Yeah.
And I'll give you a leaflet on carpal tunnel as
Yeah.
well.
Yay!
What a good boy you were. Well done.
Bless him.
OK, take care then.
Thank you.
Hello. Hi, yeah, come and have a seat. How are you?
I'm not very well.
What's been happening?
Maybe you remember I had
Yeah, and I saw you, and then you came back, you saw Dr. Ward, and then he gave you some more antibiotics, you had an X-ray.
Yes, first of all, I was coughing, only dry cough.
Yeah.
And then started to come out mucus.
Like
And
brown mucus.
yes, and pain here, especially in my chest. I'm really worried about this problem because...
You had a wheeze? Like a wheeze, like that kind of noise.
Yes, I have it now. Every time I... You see?
Can I have a listen to your chest again?
Yes.
The X-ray was clear.
Clear, so it is good news.
Very good news. Deep breath in now. Okay. Very surprised by the chest X-ray. It sounds like you've got an awful chest infection.
Yes,
But nothing's coming up on the X-ray.
How is it possible? Maybe they have made a mistake.
One thing though, credit to you, you always smile.
I got no choice. I have a job where I have to smile.
You nice smiley boy. You are.
Here, look up here.
So I don't know you at all, do I?
No,
So
I feel as if I have met you, but it's because you gave me such a lovely smile.
Oh, thank you.
Oh, okay. Nearly left you a present there. Okay.
Does she smile?
Yeah.
That's good.
You're doing well. The smile is back on your face. Very nice.
Eva? Hello, Poppet. Are you coming to see me? Yeah, come on down then.
You need to give me that back now.
But she's so much better at using it than we are, isn't she? Come and sit down. And what's your name? Eva. Hello, Eva. How old are you?
I don't know.
You don't know? All right. Are you 15? 4?
Are you 4?
Does 4 sound more like it?
Yes.
And I'm Dr. Bolger, and how can I help you today?
I have a cough.
You have a cough. Okay, and when did this cough start?
I'm talking a couple of days ago.
Temperature?
Not that I've noticed.
Okay. Do you think you can stand down in front of me? Would that be all right? Is she wheezy with this? With the cough, or just sound like a 20-a-day girl?
Yeah.
Shall we have a listen to your chest? How do I do that? Do you know? No.
That's your ears.
That's your ears. I do really well to hear your chest through there. Does Mummy want to bring you across and we'll sit you on the couch? Do you need a hand? I think you might need a hand. Fabulous. Now can you lift that lovely yellow T-shirt up, do you think? That's brilliant. What a clever girl. Do you think you can go, let's all do it. Should we get you down and put you back together again? Oh, careful. Visions of you ending up flat on the floor. So,
What you can hear is stuff in the upper airways, not actually on Eva's chest.
Yeah.
I suspect that she's picked up a virus that's given her a viral cough. She doesn't have an infection. I can't see anything to give her antibiotics for. But we know that she has asthma, so the sensible thing while she's coughing is to add the Ventolin to the brown inhaler.
Right, okay.
And then see how she goes. Having said that, if she becomes unwell with it, then we definitely want to see her sooner rather than later.
All right, Eva?
I think you can have your phone and I think you can go, because you were rather a star, weren't you? Yeah?
Little madam.
Bye-bye, sweetheart. Bye. Please don't drop that phone.
I know, it's going to happen.
Bye-bye.
It doesn't quite fit, does it? Because what I was wondering is sometimes you can have a normal chest X-ray, but you might have, so maybe you've developed asthma later on in life, right? But you wouldn't expect to find the crackles, you'd expect to find wheeze, which I couldn't hear. Let me just see something. My main concern, having assessed Tudor-Beth, was just making sure that I wasn't missing other possible diagnoses. I still thought that this was most likely a bad chest infection, despite the chest X-ray findings. The other thing that I wanted to exclude was a pulmonary embolus. A pulmonary embolus is a clot that shoots into the supply of the lungs and can block off the ability of part of the lung to work properly. Not coughing up any blood?
Blood, no. Only mucus.
I'd like to do a blood test.
Okay.
It's not a blood test we use very often, something called a D-dimer. It can point towards a direction of other kind of problems, like clots and things. I just want to make sure it's not that, so we use it to exclude it, because if the D-dimer is normal, then we don't have to worry about it. So let me just see if they're available to do the blood. Just stay here for a second, okay?
Okay.
If you bring your stuff, you come with me, we'll do the blood test now.
Okay.
Still got like 5 hours of work to do.
I'm just taking a note.
How do you feel about that? Pretend I've got a microphone. How do you feel about that?
Wonderful.
How do you feel about working with me tonight?
Terrible.
Morning, Mr. Gums. Come right in. Just take a seat. This is Priyanka, who's a student sitting in with me today,
Okay.
if that's okay with you.
That's all right, no problem.
Good. How can I help?
Yeah, Wednesday I was putting around in the house, yeah, and all of a sudden my knee it's got pain in it, yeah, and today I can't even hardly bend it.
Is it swollen?
No, that's the thing. It's not swollen.
And it just started out of the blue?
Yeah, out of the blue, just like that.
You didn't twist it
I
around?
didn't knock it, nothing.
And so, what about sleep? Are you managing to sleep okay, or is this...
Yeah, as long as I keep my legs straight.
Okay, but if you bend it at all?
Yeah, if I bend
Okay.
it, it's just...
So if you can just slip off your shoes and socks and just pop yourself over here and we'll examine
I
it.
started using ibuprofen, but I went to this pharmacy to get some pills. She asked me, she said, don't, because I'm on warfarin.
Oh, are you on warfarin?
Yes,
okay,
yeah.
okay.
Yeah, she just gives her paracetamol.
And so did you take some paracetamol?
Yeah, I took something yesterday.
So just if you can lie over here for me. What's your job? What do you work at?
Social care worker.
Ah, right, okay. So you don't do that much kneeling down or anything?
No, no.
Lie back. So just bend it up for me as much as you can bear. Yes, right, okay. Is it up here or down here or around this side or just under it?
It's more near the bottom.
On the lower half?
Yeah,
right,
yeah,
right
it's
here.
right there, yeah.
Okay, yeah. Can you feel that creaking in your knee?
Yeah.
Okay. Can I just let Priyanka feel it? So you want to just come over here, Priyanka, and just put your right hand on that. So can we just get you to do it once more? Okay, I don't want you to cause pain. Oh. Slowly straighten it out. Can you feel that creaking sensation?
I can feel it on the way up.
All right, okay. That's crepitus, okay? They've likened it to a creaking sensation, and it indicates usually inflammation in this setting. And this is inflammation of the undersurface of the kneecap as it rubs against the femur. Good.
That's what it is, yeah? Okay.
Yeah, it is, yeah.
All right.
The reason I got Priyanka to feel Calvin's knee is that there is no substitute for hands-on experience. I wanted her to feel crepitus so that she would recognize it again. Textbooks describe crepitus, but there's nothing like hands-on experience. Ideally, the treatment would be a non-steroidal anti-inflammatory.
Yeah.
But you can take those, and you absolutely shouldn't be taking ibuprofen,
Yeah.
unfortunately.
Yesterday, yeah.
So what can you do? Well, you can take other painkillers just to relieve the pain, and you can put ice on that knee, and it'll settle down if you rest it.
It's really bad getting out of bed this morning too.
I'm going to give you some codridromol just to reduce your level of pain. But remember, painkilling medication is just to reduce pain. It's not going to heal this.
Yeah, yeah.
What's going to heal it is rest, elevation, and ice.
Yeah.
And that's in your hands.
Okay, right, yeah. I will, definitely.
Good,
Let's start to...
You're welcome. Yeah,
Thanks a
nice
lot.
to see you.
Bye-bye.
Mr. Gans. Bye.
Yeah, see ya.
I'm after a favour.
What's that?
Can you stay any longer today?
No, I really can't because I'm moving cows. I've got somebody coming to pick some cows up. I'm sorry.
No, don't worry. I'll ask. I'll keep asking.
Sorry, mate. I would have done normally. Okay. I can help.
Jonathan, do you want to come through?
You know what? And I really appreciate everything you're doing, yeah?
Yeah.
But this is so much agony. There's no point having an X-ray. I know nothing's broken, but
No.
I swear to you, it's getting worse. It's a sleeping. I don't want to be signed off work. It's just no point.
Yeah.
Because my work says, like, if you really want to be signed off, but I'm like, there's no point because I can't sleep. I'm not depressed because I'm a strong human being.
Yeah.
Like, but I really am. I'm getting fed up. Not with doctors, but...
This is just getting to you.
It's just so annoying.
Okay. Well, I will have another look at your medication.
Is there anything else you can recommend?
I mean, you might think about maybe trying an osteopath to do a little bit around your neck.
Are you from around this area?
Yeah.
Do you know anyone where you can recommend? Not for free, I'll pay for it.
Yeah, unfortunately,
Okay.
osteopath.
No.
There is an osteopath clinic
I'm really
in
tired.
Maidenhead, and
Mate,
I've just
I can't
forgot.
Google.
I've forgotten the name of it.
Ask at reception.
Ask at reception.
I bought some new pillows.
Yeah.
They cost about 60 quid.
Yeah.
And I feel they're bouncy,
Yeah.
but firm, and I feel my neck a little bit more movement.
Yeah.
So there's no pain on my shoulder now.
No,
it's just here.
it's just down there.
It's just there. But I'm worried, obviously, you're a very busy man, so...
Shall we get on and do some of the acupuncture?
And last question, is there anything you would recommend, anything, to just get me sleep at night?
Get into a position that you feel most comfortable in. Make sure you don't have any tea or coffee to drink for about 2 to 3 hours before you go to bed.
Okay.
Or if you do, make it decaf.
Yeah.
And try not to eat for about sort of 2 hours before you go to bed. Right, so if you just come around a little bit for me, that's it. Great. I mean, you did get a fairly good response the last time.
I just wondered, if this doesn't work, how long can this go on for you?
Well, we can do 3 or 4 episodes of these and see how you get on. Now, I'm just going to go quickly up, make a cup of tea, and when I come down, I'll take these out of you.
Thank you.
Okay? So don't go leaning back, because good
I
wings.
can feel it working.
Can you feel a little bit or
Yeah,
something?
there's no
Good.
spasm.
Okay. Let me just get this cup of tea.
Thank you.
See ya.
So you've had some surgery done, have you?
Yes, I have, yes. Had the carotid artery. Oh, where do you want me?
And then you can, that's it, rest your head back. That's
Yes.
lovely.
You relax? Yeah. She's very stoic.
Do you know how many clips are in there?
25, 26, something like that.
Yeah, it's going to be very tender for a while,
I
isn't
had
it?
staples out before.
Some of them are, you have to go quite deep down, but these ones are good.
Yeah, all right, Mum. Yeah, just holding my head. That's
This
a tough one.
Yes. You can feel it. We'll go back to that one.
So what exactly did they do?
The main artery was over 70% furred up.
Oh, God.
So it cut her open, cut the artery open, cleaned it all out, stitched it all back up.
Oh, wow.
And she was out in 2 days.
Oh, wow.
Yeah.
Fantastic.
So she was a strong girl.
Yeah.
Girl? But she'll be 80 next birthday. But they said she was a major stroke waiting to happen. So thank goodness.
Yeah.
Thank goodness she had the little one.
It's that one, so we just have one more. This little one. Sorry, sweetheart. That's it. No bleeding. I'll just give it a little clean.
One in.
No, they've all gone. I can assure you.
Oh, you take them home if you want.
I've had them long enough. Thank you. Thank you very
All
much.
right, then.
Thank you, Kelly.
Take care, you're welcome.
Bye-bye.
Thank you. Bye-bye.
Morning. All right. That was quick. All right, let's get these out for you. Okay, that one. That one.
You're the most helpful person.
Well, thank you very much for saying it. But I mean, I think everybody here is pretty helpful, but people have different expertises and interests. That's them all.
Oh my God. I don't know what that does, but my elbow is no pain. Oh, that is heaven.
Is that better?
Yeah, I can know
Oh,
this
good.
space and I can move it like
Good,
that.
good. Well, that's good.
I find myself in bed.
Yeah.
Very quickly, I find myself sleeping like that.
Yeah.
To try and not move it. Oh, that's heaven.
And unfortunately, the good thing is to move it, because the more it spasms, the worse it gets. That's the problem.
That's right, thank you very much.
There you go.
Cheers.
Right. Well, good. So we'll try and do something on Monday for you.
Oh, so reception run about.
Yeah.
Thank you, Peter.
Not at all. My pleasure, Jonathan.
If you would take an incentive, I would happily pay you.
Don't worry about it. Thank you very much. That's very kind of you to say.
Thank you.
I'm glad you've got some benefit. Cheers then, Jonathan. All the best.
People keep phoning me trying to sell me things and make me do things.
I'm not interested.
I've been trying to contact you about your PPI. I've never claimed PPI.
They wind my husband up, actually, and when he answers the phone, they go, oh, you had an accident. He said, oh, yeah, just let me know where it was and when it was, and I'll claim for it.
How can I help?
13th of this month.
Yeah.
10 days ago, I had a hernia, spaghetti hernia repair.
Okay.
It was keyhole.
Yeah.
And I got about 10 or 12 little incisions.
Yeah.
And yesterday morning, I was awake all night, Saturday night, and I was laying there yesterday morning thinking, sorry, what's wrong? And I was laying like that, and I've got a bit of a lump under one of the incisions. It's almost the size of an egg.
Okay. Let's check your blood pressure. Check your temperature. Okay, temperature is fine. Okay, so if you can slowly come down this way. Right, should we have a look?
A little bit there. Oh, that's...
That's all, is it? Yeah.
It's all there.
Is this the one you're talking about?
Yeah.
It's around the site where the laparoscope instrument has gone through.
Yeah.
That's where it is. So, so there is a mark there too, and I can feel the lump under that mark. Yeah, that's sore as well, isn't it?
So is it tissue? Or...
So yeah, sometimes what happens is what we want to rule out is a bleed under the under the wound, okay, which we call as a hematoma, but it's a slightly bigger than what we normally would see. So I think what you might need an urgent ultrasound.
Come in. All the best. Bye. Hello. Got a great old knock there.
Come in. Ta-da! Do you know, I actually got excited about this. Did you? I did. Just a little bit.
Come in. I've got a skin thing that I'm completely befuddled by. Okay. So I'll come. Thanks.
Come in.
Hello.
Hello.
Have you done a prescription for an Andrew? Aaron, yes, that's the one. Thank you.
Sorry.
No, that's all right.
Thank you.
Thank you.
Come in. I'm not doing telephones. It's like time to practice in Piccadilly Circus today, isn't it?
Hello, come and take a seat. I'm Dr. Allen. What can I do for you?
I've had a really bad ear in the night, and it really hurt. And when I woke up, there was blood on the pillow, and it was bleeding as well, and I don't know.
Has the pain improved since
The pain has
bleeding?
improved, yes. But I flew back from Spain on Sunday. I don't know if it's the pressure of the blood on that.
Oh, yuck. Oh, it's oozing away, isn't it? Okay, right. So there's no drum whatsoever in there. Lots of bubbles and blood.
Right.
So I think we're going to treat this as an infective cause.
I feel a bit lightheaded. I've got a bit of a cough and like a head cold.
You will do, because your ear is your balance mechanism, and when the drum goes, 1, you go deaf, and 2, you feel very unsteady.
If I go swimming and I get water in it, I'm in agony.
It's bizarre. It's like honeycomb but with fluid in it. So what we're going to do today is put you on some antibiotics. You need to keep the ear dry, so when you have a shower, pops like you had cotton wool in there to stop the water getting in.
Oh, it woke me up. It was really painful.
Well, it's like having a balloon with the pressure rising.
And then all of a sudden it went goo 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 goo, and then I looked on the pillow and there was blood on it. I thought, oh Christ, when you're bleeding from the ear, you know, you should think to yourself, you know.
The end is nigh, yes. So the antibiotic is amoxicillin. Hang on! 1 tablet 3 times a day for a week. Right. Keep your ear dry. I need to book you in for 10 days' time. 1 minute. Oh, it's a lady with important things. Do you mind if I get my tea and cake?
No.
Oh, you know what I'm having.
I know.
Thank you. Thank you, ladies. Thank you.
No, I can't have them because I go to the Healthy Heart.
Oh, right.
What Dr. Joanji done for us, and I've got 2 more weeks of that to do, and tomorrow we start doing the gym work.
OK, well, let's see if this heals, and then we'll take it from there.
Thank you very much,
Take care of yourself.
Thank you.
All right,
bye-bye.
bye-bye.
I was in KFC yesterday, right? This guy behind the till, he was like, whereabouts are you from? Because you sound like someone from Jersey Shore. I was like, what? Oh, no, made in Chelsea. Where's that? Where's Chelsea?
London. They talk really posh.
So do I.
Hello, hi, is that the surgical registrar? Yeah, hi, Dr. Sheikh here, one of the GPs. Just wanted a bit of advice. I wanted to discuss about a patient, 50-year-old lady. She had a laparoscopic right vigilant hernia repair just 10 days ago. She has noticed a painful lump at one of the incision sites. No sign of infection. I don't think there's an infection, but the lump is a bit worrying too. I think she needs to be seen, yeah. All right, can I send her through? Thank you, yeah, bye. So are you okay to go straight from here?
Yeah.
And your heart rate is slightly high as well.
Is it?
That can sometimes be due to pain.
Yeah, what was it?
It's 100.
100?
Are you stressed? You've been thinking about it?
Yeah.
I think you must be worried about the lump. It's unusual, and it's probably just getting your heart rate up a little bit. And you're in pain at the moment, so...
And you're in pain as well, yeah. OK, so if you take this letter to A&E, and they would call the surgeons to see you in A&E. OK, all right? No worries, take care. And I hope everything goes well for you today.
I'm sure it will. If not,
All right,
I'll have
take
to
care.
punch her. Thanks, Doctor.
Thank you,
Thanks
bye.
very much. Bye-bye.
Can I make an appointment from Sister, please?
Does Dr. Bolger, yeah?
Is indeed, yeah. She's a popular woman, isn't she? I always say she's a bit like the Wizard of Oz.
Yeah.
We went to see that Bridget Jones's
Oh, was it good?
baby. I keep wanting to say diary.
I did see the other 2, so I just wondered if it was silly or, you know, a bit too silly.
It's not too silly, no.
Oh, that's good.
No.
Have you seen the recent Panorama program about diabetes, the hidden killer? No?
I must admit, I did like Hugh Grant in it as well.
Yeah, he's not in this one, no.
He's in it, though, isn't he?
Colin Firth.
Yes,
Colin Firth's in it, yeah.
Colin Firth is lovely, though, isn't he?
Okay, how can I help today?
I had my blood pressure done, and then the pharmacist said to come and have a chat with you about it.
And what did they say to you about your blood pressure? And
it was a little high again. Yeah.
Have you known to have high blood pressure before, or?
It was high like 10 years ago.
Right.
And it's been good ever since. But
That's
we've had a
brilliant.
lot going on in the family this year, so...
Okay, I'm sorry to hear that. Is that to do with your immediate family, or?
Yes, we've had 7 deaths in 5 months in the immediate close family members.
Oh, I'm really sorry to hear
So
that.
I'm not surprised.
So you've been
that,
through so
yeah,
much.
Yeah.
So no wonder you're
Yeah, not surprised that it's all over the place at the moment.
Have you had strokes, heart attacks before? Nothing like that?
No.
Known to have any high cholesterol?
Yes, I suffered high cholesterol.
Okay. And anything in the family, like any type 2 diabetes, heart attacks, strokes, anything like that in the family?
Oh, yes. My dad had high blood pressure. He had a stroke. My mum had a stroke. She had heart problems. She was diabetic. My sister's diabetic. She has heart problems.
So it's quite, yeah.
So it's in the family.
It's in the family.
Yeah.
The simple matter is we just start you on one tablet at the beginning to see if we can control your blood pressure, because obviously the 10-year risk of having high blood pressure are things like, unfortunately, heart attacks and strokes. Yeah. So we need to minimise your risk because you've obviously got the family history. And we need to do the urine dip and the ECG.
Okay.
Oh, you've done the ECG. Your ECG was normal. So the only thing now you need to do is book in with the nurse in a week to get the urine sample. Okay. Should we do your...
Yeah, because I mean...
And then just relax your arm like that for me.
My problem is that there's 3 people at home that depends on me.
Right. Who do you live at home with?
My son's epileptic, so I'm his carer.
Oh, my goodness.
And then he's got twin 6-year-old.
He's got twin 6-year-olds himself, right?
Yeah, and one's type 1 diabetic, and the other one's ASD.
Autistic.
Oh, he's autistic.
Spectrum disorder.
Yeah, and I suppose I'm just a little bit stressed.
So no wonder all the stress is just... Right, just try and take deep breaths.
My brother-in-law died, and then like a month later my mum died. She had to go to the Caribbean, and while we were out there, her cousin died.
16585. So again, it is, and your pulse is weirdly low. Sorry, I'll take this one here.
Her friend died the week before we buried her, and the week after we buried her, her cousin died.
I thought Caribbean's going to relax the person. Oh my God.
And then the day I came back, I heard my dad's cousin had died.
Right.
So then, okay, no more.
God, goodness. I think we should really start the 5 milligram amlodipine because I think you're at that borderline, and with your really strong family history.
Yes, I think we're better.
Yeah. And in a week's time, the nurse will recheck the blood pressure to see if this tablet working on you.
Okay.
If your blood pressure hasn't come down within a week, we know it's not the right. Either we increase the dose or change to a different tablet. Is that okay?
Yeah, that's fine.
Perfect. Oh, did I give you the prescription?
Yeah, I've got it in the
lovely.
bag.
Take care.
Thank you very much.
Bye.
Is your name Mandy? Your mum's friend, Vivian?
Oh, okay.
Yeah.
Hello, I've just been for an ultrasound. They've given me this report to give back to
I don't want it.
my friend Dave Ward.
Is your friend, is he?
Yeah,
Cool, you're one of the few, are you?
I like him.
I know, so do we, darling.
Hello, here's my friend. How are you? Come on, let me have the chair up, please, so I can see you. There we go. That's better. I love your wheelchair. I think it's brilliant.
Mrs. Brown? Hello.
Hello.
I'm Barbara.
Nice to meet you, Barbara. You've got one nervous patient here.
You'll be fine. Just remember to breathe.
To breathe?
Yes.
Yes.
Don't hold your breath, breathe.
Just
and
breathe.
It'll take just a minute and we'll be done.
Correct me if I'm wrong. Are there 2 sizes of the...
Speculum?
Yeah.
There are actually 4 sizes. It's no more metal. When you did before, it was a cold metal. It's a plastic that I run under warm water, so it's warm. It's not cold anymore.
Okay.
And I promise I will not hurt you.
I've got every faith in you. I just think it's very, very important that we have it done.
Yes, it is very important. And I'll make sure I tell you what I'm doing, so you're not nervous.
Okay.
All right. It is a screening test, so it's not a diagnostic test. So what I'll do is I'll take a sample of cells and I'll send it off to the lab. At the lab, they'll check for any abnormal changes within the cells. If there's any abnormal changes, they do a further test on the sample called the HPV test.
Okay.
So HPV stands for human papillomavirus. So I'll pull the curtains around you. Take your lower bits off for me.
Yes.
And get on the bed. Give me a shout when you're ready.
Yes.
And I'll do this.
Okay.
Okay.
Will do. Thank you, nurse.
Okay.
Thank you very much. Oh, these are much better, aren't they?
Yeah.
I put this here so you can put your trousers and stuff
Lovely,
on.
thank you, nurse.
Right.
Thank you. You'll have to really excuse me if I'm a baby.
You're fine. Trust me.
Oops, Daisy. There you are.
Can I come in?
You may.
All right.
Is that okay?
Yes. You feel my hand first, okay? And then let's buckle on. Remember to breathe for me. Sorry. Well done. That's the hardest bit done. Relax. Okay, try and relax for me. What do you like doing?
I like jigsaw puzzles, and
do you?
yeah, they're my favourite.
Sorry.
Oh, I know you want me to relax, but oh no!
I am so sorry.
Your cholesterol tablet, are you not taking them?
No, I'm not.
Why is that?
Because I'm getting forgetful in my old age.
You're only 49. You're not old.
You know how I found that I was low on vitamin B12?
No.
I kept on forgetting things.
Do you want it written down? Yes, please, because I will forget, because I've got so much to do today for tomorrow.
I fell down the stairs last year. I lost my memory for nearly 4 weeks.
Oh, gosh. It's the worst, isn't it, the baby brain?
My other sister, she's pregnant, and my God, her baby brain. I'm just like, I just told you that.
You're taking 2 sorts of tablets for your diabetes, yeah?
I skip sometime, not every day.
Why? Why do you skip?
I forget.
Oh, okay.
How can I help today?
Yesterday, I noticed I've got a gash on my leg. Now, I don't remember banging it, but the way my legs are feeling recently is if I even trod on a nail, I don't think I'd feel it. They feel like
You've got diabetes, haven't you?
border.
OK. It's not looking like it's spreading anywhere.
Right.
It looks like it's all kind of staying in one place, which is what we want it to do.
Do you think, in your observation, you think I've knocked it?
It looks like you may well have done, without perhaps realising it at the time.
Yeah, because when you're younger, you hit yourself and you go, and of course, but I'm getting older, so I'm forgetting things, but I don't remember banging it.
Sure.
Not
OK.
at all.
In patients with diabetes, wounds can often tend to heal quite slowly, mainly as a result of impaired circulation and nerve damage. And the risks of this ultimately are long-standing infections, gangrene, ulceration, and ultimately amputation in some cases.
Look how swollen I've become. Isn't it terrible?
Okay. Is it the same both sides?
Yeah, both sides,
Swelling-wise?
yeah.
OK.
Since an operation. All the scabbiness and the dryness. Now I can't bend to grease my skin, whereas I did before.
Oh, right, okay.
My kids are half Indian, half black, so oil in my skin was a natural phenomenon. But
Yeah.
I can't do any of that now.
You mentioned that you can't reach. Is there somebody that could?
I've only got a 21-year-old boy at home,
OK.
and him being a young fella, I can't say to him, can you grease it?
Why not?
I think that if I asked him to do it, I just don't know, I just feel too embarrassed to ask him.
It looks dry, and when skin is dry, there's a chance of it cracking, and when skin cracks, infection creeping in. So the win-win situation here would be getting somebody to perhaps apply some decent emollient on a regular basis.
Really?
Can I prescribe you some?
Yes.
So that you've got it.
So I've got it. Then if someone comes and says, just
Yes,
stick that on.
absolutely. Yeah, absolutely. There's 2 things I'm going to prescribe. The small antibiotic cream for the slight kind of abrasion there.
Yeah.
The other one is a tub of emollient.
Yes.
This one comes in the form of a gel.
Must be something new. That's amazing.
That's all done for you.
OK, sir.
All right.
And you.
Nice
Thank
to meet you.
Nice to meet you, sir.
Take care.
See you again. God bless.
Bye now.
I am so sorry.
Don't be sorry. You haven't seen me getting mine done.
I'm going
I'm
to
like a chicken, screaming all over the place.
Was you nearly there?
Yes. So I've got gel on this to make it easy for you, OK?
OK.
All right. Relax. Deep breath for me. There it is. I'm so sorry. I have found it. Remember to breathe. I'm going to take the sample.
Oh, dear.
I know.
That is the most uncomfortablest thing I've probably ever had, but I don't care how.
I am so sorry.
Oh.
So I'm done.
You done it?
Yeah.
Did you get one?
I did.
Oh, I'm
You know the
so
first.
sorry.
Don't apologise. It's only natural.
Barbara, I can't thank you enough that that you've managed to do it. I really can't.
You are fine, and you're welcome. If you don't come, I don't have a job.
So I just wait now, Barbara.
Yes.
To hear
If there's anything, they'll call you on the telephone number you've given me, and they'll refer you on for treatment. If
everything is okay and no abnormal cell is found, you have your result as a letter to your home address within 3 to 4 weeks.
Yeah.
And the hospital will decide whether we see you again or this will be your last.
And if they do want to see me again, I'm going to say that I want Barbara there.
Oh, thank you.
Thank you very much, Barbara.
You're welcome.
I really, really appreciate it.
You're welcome.
Thank you very much.
You're welcome.
Very kind.
Thank you. All right. Bye-bye.
Is that scribbling?
It's scribbling, yeah. It's my neat writing. It takes a long time to learn how to write like that. All right. See you later. Take care. I absolutely love my job. I couldn't see myself doing anything else. I genuinely enjoyed getting to know my patients, knowing everything about them, all the ins and outs and what makes them tick.
It's been a good relationship between us both. Well, I've enjoyed it.
Good, so have I. It's been a pleasure looking after you. I can remember sitting in my GP surgery, aged 8 years old, not feeling very well, and the GP telling me what he thought was wrong with me and what was going to happen. And I just remember thinking, wow, that must be great.
Best thing about being a GP is that you are given insights into patients' lives that they will not necessarily give to anybody else, and that's a real privilege.
There's always challenges, there's always surprises, and it's just never the same thing every day, so it's just such a worthwhile job.
Quite happy today, I'm quite surprised.
It's because I'm positive again.
Good.
I've had 6 months, but I'm just
good.
Got my things. See you later. Bye-bye.
When I wake up in the morning, I feel great to come to work. Very few people can say that.
You're a great survivor.
I keep going.
We enjoy the work, despite how hard it is. We enjoy going home at the end of the day, like everybody else, knowing that we've probably helped a lot of people. I don't know any GP, particularly those I work with, who don't feel that to be the case.
Bye-bye, dear.
Thank you. Well, dear.
Where are you?
Come on. Thank you. Well, have a nice day, doctor.
Yeah, and you.
Thank you,
yeah.
doctor.
Bye-bye.
Being a GP is absolutely a vocation for me. It is the reason I breathe, it's the reason I live, it's the reason I get up in the morning, and it's the reason I go to bed at night contented.